Hello, I'm Chris Stout, and I'm a vascular and endovascular surgeon at Ozark Regional Vein and Artery Center. Today, we're going to talk about endovascular treatments, including angioplasty and stenting. Endovascular is one of those big fancy words, again, that I don't like too much, but it's a necessary word. Basically, it's the minimally invasive way to fix the arteries and some of the veins in the body where you don't have to actually do surgery to cut somebody open anymore. You can fix these through, a little poke in the groin and catheters and wires, and that makes it much more less risky for the patients. And we can do multiple different types of these procedures here in the office at Ozark Regional Vein and Artery Center. One of the big things is it's all done either through the wrist or the groin or the foot, which is something that we're going to offer. And I am going to offer this area of Northwest Arkansas that nobody does these procedures through these different access sites. And that's going to cut down on complications of even the minimally invasive procedures. So we're going to make minimally invasive even more safe. One of the things that we're going to be using to help do this, so this is basically a wire, and these wires are floppy and they're relatively long. So if this wire is going to be this long wire, it's kind of scary, but basically this is going to allow me to navigate around your plumbing in your body, which is basically what the arteries are. They're tubes and they're all connected, so I can get from one tube or one artery to the next one. Once we're able to get a wire across the blockage, whether it be in a neck artery, an arm artery, a vein in the pelvis, or in your lower abdomen, or an artery blockage in the leg, if I can get the wire across it, which we're successful about 95% of the time. And then we use different technologies and, fancy angioplasty balloons and stents, and there's multiple different iterations of each kind. But basically, they're all the same. They're basically going to be a balloon which goes into the body compressed, and you're going to be able to slide this over that wire to wherever it needs to be. And then we're going to inflate this balloon to whichever size we need it to be. And that is going to be held there, and that is going to stretch not only the artery, but it's also going to compact that blockage really tight. And then basically after a minute or so, we're going to take that balloon down, and then I'm going to pull it out of the body. And that is one of the good ways to fix a patient, because you don't have to leave anything inside the body. You basically stretched open the artery, you've pushed out all that blockage and all that plaque to the side, and then the patient can benefit from the increased blood supply. Now, there's other ways we can fix it also. A stent sounds kind of intriguing, but basically this is a stent. It's like a rolled up fence, that is connected. And the stent is something that can be long, or the stent can be short. The stent can be smaller or bigger. And it just depends on what part of the body we're fixing and what stent, where it goes. One of the things about stents is kind of neat. We have stents that are going into the body just like this, kind of like that balloon I showed you. And then once we get it in the body, we slowly deploy it perfectly in the body. And the neat thing is it expands. So once the stent gets in there, it expands. It goes in really tiny, and it basically pushes that plaque or that blockage behind the stent so that the artery can stay open. So if you're having any types of symptoms of artery blockages, of pain or aches or cramping, we've seen all the technology that we have and the different ways that we can fix the arterial blockages. Come into Ozark Regional Vein and Artery Center today and see what we can do to get you back into your life again.